Hello. Right now we're going to talk about high blood pressure. You know, we really should all be looking at our blood pressure so that we can be healthy and prevent heart disease, heart attacks, and stroke. It's important to look at what our blood pressure is. You may be wondering how to test your blood pressure. You know, if you go to a food store like the grocery store, or you go to a drugstore like CVS or Walgreens, whatever, many times they'll have a little seat where you can put your arm into one of those cuffs that you'll see at the doctor's. So you press a button and it squeezes up on your arm and it does hurt a little. And then when it's finished, it'll show you your blood pressure numbers. So let me explain a little bit more about those numbers. You might be wondering, what does 120 over 80 mean? You know? So the top number, the first number, is called your systolic number. And the bottom one is your diastolic number. So your systolic number, that means, you know how you have blood moving through your body? It's the pressure that the blood creates. And the diastolic one is the actual, like, the space between the pressure. So the pressure and then the time in between the pressure point. So if you want to know how to keep your blood pressure healthy, you need to know that at first the top number, the systolic number, should be 120 and the bottom should be 80. That's about normal. If it's 120, like 5 to 139, or if it's higher on the bottom, then you might have pre-hypertension. That's not a label of having high blood pressure yet, but it means that you could have high blood pressure soon. So if it's even higher than the 140 or whatever, if it's too high or too low, I'm sorry, if it's too high, you might know, but you might be a little confused. You might have headaches. In that case, you really should go to the doctor. They do have medicine that can get rid of high blood pressure. And they will show you how to eat in a healthier manner so that you can reduce your risk of hypertension.